Welcome back to Face the Nation. We turn now to the director of the Centers for Disease Control, Dr. Rochelle Walensky. She joins us from Boston this morning. You heard the British Prime Minister give himself a little bit of wiggle room there on committing to reopening schools in his country next month, particularly given this new research on B117, that highly contagious strain that now is found to have higher hospitalization and death risk associated with it. Should areas of this country where there is B117 still have in-person classes?
There are over 1,000 B117 cases that we have documented in this country in 39 states. We know now that, or we estimate now that about 4% of disease in this country is related to B117, and we have projections that it may be the dominant strain by the end of March. That said, the amount of disease in school is very much related to the amount of disease that's in the community. So the work that we do to decrease the amount of disease in our community is that much more benefit to getting our schools reopened.
But you said on Friday at a press conference that 90% of the country's schools are in areas with high levels of transmission. Don't those schools risk becoming vectors of transmission?
So what we know from the literature, from the scientific literature, is that most disease transmission does not happen in the walls of the school. It comes in from the community. There's very limited transmission between students and staff, really mostly between staff to staff when there are breaches in mask wearing. So what we're really advocating for now is working to get especially in the high areas of transmission, the red zones you just talked about, getting our K-5 kids back in a hybrid mode with universal mask wearing and 6 feet of distancing.
So those protocols still apply with these new variants in places like South Florida or California, where there is a high degree of these mutant strains?
Indeed, it is the same disease. We prevent it in the same ways. Our mitigation strategies work, whether it's a B117 variant versus a wild-type variant. The B117 variant may be less forgiving when we have breaches in these mitigation strategies, but the mitigation strategies are indeed the same.
The CDC data that we looked at from last year shows that the proportion of mental health-related visits for children has increased nearly 24% over the year prior. But mental health isn't mentioned in those guidelines that you released this week.
We are absolutely worried about all of the collateral damage that we are going to see, not just mental health, of course, mental health, but not just mental health, loss of educational milestones, food insecurity that has happened with our schools being closed, which is why we were really prescriptive with this guidance to provide states and localities with the information that they need so that they can open safely.
But on the mental health portion of it, are you going to issue new guidelines on how to deal with that?
Well, we will be certainly watching that space, and we'll be looking to our mental health colleagues and looking to where and when guidelines are necessary.
When you were last with us, it was just right before the inauguration. And at that time, you predicted the country would be at close to 500,000 deaths by mid-February. That's almost exactly where we are right now. What do you think the trajectory is from this point?
I think so much depends on how we as a country behave. We still have 100,000 cases a day. We still have somewhere between 1,500 and 3,500 deaths per day, and yet we see some communities relaxing some of their mitigation strategies. We are nowhere out of the woods, and as you note, if we relax these mitigation strategies with increasing transmissible variants out there, we could be in a much more difficult spot. So what I would say is now is the time to not let up our guard. Now is the time to double down, still with 100,000 cases a day, still with over 2.5 times the cases we had over the summer.
So you're talking about places like Montana and Iowa where they have lifted masking requirements. You say that's a mistake.
Indeed. Indeed. I think we're not out of the woods yet. We need to get our kids back to school. We need to get our communities back to some normal functioning before we can start thinking about letting up our mitigation strategies.
I want to ask what you've changed since you've taken the job at the CDC, because when you were with us last, you talked about the need to scale up surveillance and sequencing to basically figure out where these new variants are and to do it quickly.
I think that there's a lot of change that's happened at the CDC. I'd invite my colleagues there to comment as well. What I will tell you is, first of all, we've released the school guidance, which has been long in coming. We've really wanted to get that out, and now we have done so. In terms of the variant specifically, we have much more sequencing happening. We have collaborated with departments of public health. Each state is now giving us strains for sequencing. We get over 750 of those per week. We have collaborated with commercial labs with the intent of sequencing over 6,000 viruses per week, as well as collaborations with universities with the intent of really scaling up our sequencing so we can have a really good sense of how many variants are out there and where they're located.
But how much are we actually getting a glimpse of right now? Where are we? 5%, 10%?
We are in the beginning of January, early January, we were sequencing about 250 a week. We're now over 4,000 a week with the intent, and we're doing more and more every week.
So it sounds like you think there's still work to do to figure out where virus is spreading in this country.
Absolutely. We have the intent to do more and more sequences every week. We need resources in order to do so, but the scale-up has been over tenfold just in the 3 weeks we've been there.
When do you think the pharmaceutical companies that have developed the vaccine we have now need to switch over production to deal with these new variants?
What we know now is the major variant that's circulating here in the United States is B.1.1.7. That's the one that came from the UK. We know in the lab that the current vaccines actually work quite well against B.1.1.7. That's according to laboratory data. We don't have any data here yet to demonstrate otherwise, although we're watching it extraordinarily carefully. In the meantime, the pharmaceutical companies are adjusting their manufacturing, their science to directly neutralize the B.1.1.7 variant. And so we are both watching what's happening on the epidemiology with those who have been vaccinated, but we're not waiting for that. We're doing the science to scale up different vaccines in case we either need bivalent vaccines, that is a vaccine that has 2 different strains, or booster vaccines. Both are happening.
Both are happening. Doctor, thank you for your time.
Thanks so much.
We'll be right back. We want to go now to the president and CEO of pharmacy chain Rite Aid. That's Hayward Donegan. She joins us from Tampa, Florida this morning. Good morning to you.
Good morning. How are you?
I'm well. As of this week, your stores and other pharmacy chains are now receiving directly from the federal government doses of the COVID-19 vaccine. According to your press release, you'll get 100 doses initially for stores in California, Michigan, New Jersey, Ohio, Pennsylvania, Philly, and New York City. What difference does it make to get the vaccine directly?
Well, it's long awaited. We're super excited to be getting these doses directly so that we just have the ability to protect more people in a meaningful way. So we have been doing over 140,000 shots so far with state governments and local municipalities. So we were in the whole process much earlier than we ever expected, even with the states. But it's just exciting to be picked in these states as one of 2 pharmacies that will be distributing the federally allocated doses.
So with those newly allocated doses, I mean, how many vaccinations do you think you'll be able to conduct each week? And how many did you do this week, for example?
Yeah, so we're doing, we got 116,000 doses last week. And so those are already in process. We are administering, as you said, 100 doses per store per week. There's 1,160 stores. And we anticipate and are hopeful that that volume will go up. So we're doing, essentially 20 shots a day per store.
So can you explain what the registration system will look like? Because I'm sure I know plenty of people, particularly older people, who really struggle trying to figure out which website to go to at the state, at the county level, which store to go to. How are you going to streamline that part of the process?
Well, at this point, it's all still being handled by the state and local jurisdictions. And if you go to riteaid.com/COVID-19, and then you go into the vaccine eligibility section, we have a daily update by state, by jurisdiction, that shows you exactly which link to click on to register for a vaccine and updates you on the status of Rite Aid's participation. We do not currently schedule in the stores, so you have to go through the state or local jurisdictions websites, and that's who we'll point you to. And then you can pick a Rite Aid, or you can pick a Walmart, or you can pick a Publix, or whoever's been named and allocated doses to register with. And of course, the supply continues to be not able to meet up the demand. So we still have very long waiting lists, but we're hoping that in the April-May timeframe, when you hear about all these new doses becoming available, at some point, we're hoping that you can go directly to us and register on our scheduling system. But for now, you need to go through that link. And we feel as if this is a great source of information for people who are very confused.
So you said back in January, you said it yourself at an investor conference, that all of this is pretty confusing because of how states are breaking this down. How would you advise the Biden administration to change it? Should the private sector be taking more of a role in every part of this?
I think the private sector is more experienced with these scheduling tools and registration tools, which are very much stressed right now. And so, I always think that the private sector who build these tools and scale these tools in the cloud from a technology perspective would be the best people to help in this regard, as well as with the call centers. And I know that the governors are doing a wonderful job as best they can. For example, the governor of New Jersey putting their own call centers together and trying to do as much of this as they can. But the demand is so high that I do think the private sector can play a role here. We ourselves have built our own scheduling tool.
Dr. Marcela Nunez-Smith, who leads the Health Equity Task Force for the Biden White House, has talked about trying to get vaccines into socially vulnerable areas. On this program back in November, CVS's CEO said they could put mobile trucks and vans into underserved communities. Do you have plans to do things like that?
We can really do anything, and we are prepared to do anything and everything. We are staffing clinics today. I think the federal government has done a really good job in the prior administration and the current administration with the testing sites, really focusing on socially vulnerable areas and making sure that we provide as much coverage there as we can. They're doing the same thing right now in terms of making sure that where they pick our stores, for example, is ensuring adequate coverage for both geography and socially vulnerable communities. So there's an ongoing dialogue daily about this. And as we roll both testing and vaccines out, they're very focused, as are we, on making sure that we cover those communities.
Have you seen a drop off in testing? Because the COVID tracking project says there's been a 20% drop in testing since President Biden was inaugurated.
There has been. Our assumption is that it's because the holidays are over. And we are assuming that there might be a pickup after the Super Bowl. But right now, we think it's just people are a bit weary. They're probably taking a little break after Christmas and Thanksgiving or the holidays. And so we also have seen those tests drop off. But we have just rolled out to 1,200 stores free testing, because we anticipate that testing will continue to be a very important tool in the arsenal of Americans.
All right. Thank you very much for your time today.
Thank you.
We turn now to former FDA Commissioner Dr. Scott Gottlieb. He sits on the board of Pfizer as well as Illumina, and he joins us from Westport, Connecticut. Good morning to you.
Good morning.
I know you agree with the CEO of Rite Aid there that the private sector should take a more direct role in more of this process. Do you see the Biden administration eventually getting there?
Well, I think they're doing it right now, the Biden administration. I think they're taking an all-of-the-above approach in terms of trying to push this out and create more access sites. The one recommendation I would make is that I wouldn't devote as much federal resources to developing these mass vaccination sites. I think people who can go online, register, drive to Dodger Stadium, wait in line, take a half a day off from work to get vaccinated, those are people who could be serviced by Walmart, CVS, Rite Aid. I would be taking the federal resources and the state resources and creating more bespoke solutions that can be used in some of the hard-to-reach environments, some of the underserved communities, where you can move mobile vans into those communities, try to work through community groups, local providers, church groups, community health centers, to try to get harder-to-reach populations vaccinated. That's a very difficult effort. It's expensive. It's a bespoke effort. It's a hands-on effort. I'd be marshaling the federal resources towards that kind of a mission and letting Walmart work off the easy demand and Rite Aid.
The Biden administration purchased 200 million more doses. That gives them a stockpile about 600 eventually once it comes off the production line. You heard me talk with the CDC director, and I asked her when production should shift to those treatments of new variants. She said that is happening now. What can you tell us about where we stand in terms of being ready to protect against those new variants?
Well, look, I think we have plenty of time to get this right for the fall and have vaccine boosters that could cover these new variants. The development work is going on right now, so all the companies are developing new variant vaccines, including Pfizer, the company I'm on the board of. The question is, when do you start shifting over your manufacturing? And I think you're going to need to probably make that decision at some point in July, August at the latest. And you might not shift over all your manufacturing. You might shift some of your manufacturing towards those new variant vaccines, because remember, they won't be fully through clinical trials yet. So you don't want to throw all your eggs into that basket, but you do want to create some supply that you'll have it on hand come the fall if you need those vaccines. So I think that's about the point where you're going to make that decision. The time to starting the manufacturing process and actually getting finished vaccine off the line is about 2 months. So if you start manufacturing in July, you'll start getting vaccine off the line in time for the fall.
You heard the British Prime Minister stand by his decision to continue vaccinating his populace with AstraZeneca's vaccine, even though it has shown itself to not be as effective in early trials against the South African variant. The WHO is sticking with it, too. Is that a mistake?
Well, I think if we're going to do that, we need a plan B. I understand why they want to do this. They've manufactured a lot of this vaccine. It's cheap. It's accessible. It can be put into low and middle income countries because of the handling requirements. It doesn't require complicated cold chain storage. But if you're putting a vaccine into those markets that we know does not cover B1351, the South African variant, very well, if at all, you have the risk that you could select for that variant in those markets. And so you need a plan B on what vaccine you're going to deploy to those regions if, in fact, B1351 becomes prevalent in those regions after you vaccinate with the AstraZeneca vaccine. And the problem is you may foreclose the one vaccine that's the most likely candidate in those markets, which is the J&J vaccine, because it has very similar storage requirements. You would want to use that vaccine. But in fact, the AstraZeneca vaccine is very immunogenic against the vaccine vector. So what they're using to deliver the COVID gene sequence is a chimpanzee adenovirus. And it turns out that that adenovirus that they're using is very immunogenic. It creates antibodies that can attack other adenoviruses, including perhaps, and we know this for sure, but perhaps the J&J vaccine. So you might foreclose the opportunity to use that vaccine in these markets, which means you need another plan B, which might be the mRNA vaccines, like the vaccine that Pfizer produces, the company I'm on the board of. But those vaccines are harder to handle in those markets because they require more complicated cold chain storage. So we need to work this out right now.
That's a pretty big warning that you're making right now.
I think they need to have a plan for that. Yeah.
I also want to ask you about these comments. They were pretty sharp, I thought, from the Biden administration's national security advisor, Jake Sullivan. He said yesterday that the Biden administration has deep concern about the World Health Organization's investigation, Chinese interference in it. He demanded handing over data. That's exactly what the Trump administration demanded as well. What is it that China still has here that we need to know?
A lot of data. Well, first of all, they have antibody testing on the people who worked in that Wuhan lab. They didn't make that available. So you'd want to know if they have antibodies to the coronavirus. That would be an indication that maybe they got infected. Now, those antibodies will wane over time, but you at least want to look at that data. We want to see sequencing data on retained samples from people who were admitted to the hospital in October and November with viral syndromes that looked like COVID, to see if this infection was spreading earlier and try to get closer to the source of the initial outbreak. That data is certainly available. The Chinese have that. Yeah. So there's a lot of data that was not made available.
Dr. Gottlieb, thank you as always for your time. We'll be back in a moment. The Senate impeachment trial put on display some harrowing new sights and sounds from January 6th as protesters stormed the Capitol and made their way into the Senate chamber. We asked our senior national correspondent, Mark Strassman, to take a look at those images.
January 6th, American democracy's day of infamy. Watching this montage of mayhem, USA! 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 It's spasms of menace and malice. This is America?
We were normal, good, law-abiding citizens, and you guys did this to us!
We learned a lot this week about how appalling many moments were. Pro-Trump rioters bludgeoned police, dragged them down flights of stairs.
Looked like a medieval battle scene. At one point I got tased. People were yelling out, we got one, we got one.
More clear than ever, the mob of hunters almost got elected leaders.
Nancy! Where are you, Nancy?
Here you see Senator Mitt Romney abruptly reversing course away from rioters now inside the Capitol. With gallows set up outside, the Secret Service whisked away Vice President Mike Pence and his family. An aide carried what appeared to be one of the 3 nuclear footballs. Rioters came within 100 feet of them. Representatives and staff cowered and cried. Video showed Chuck Schumer and other senators evacuate the Senate floor. The newly complete narrative laid out this week, its arc of thuggish behavior, seditious acts, and close calls, was a gut punch to our sense of self and to senators watching the presentation.
I mean, I had tears in my eyes. You heard every single breath, every single sigh.
But after an acquittal on the impeachment charge, there's worry about a lingering threat. What this video says most of all, no one wants to see a sequel.
If we pretend this didn't happen, or worse, if we let it go unanswered, who's to say it won't happen again?
For Face the Nation, I'm Mark Strassman.
We'll be right back. That's it for us today. Thank you for watching. We did offer invitations to over 24 Senate Republicans to join us today. No one accepted. Until next week, for Face the Nation, I'm Margaret Brennan.